to give
Hello.
his hello. Can you hear me?
Yes, sir. Yes, sir.
I invite
Hello.
Dr. Madhusudhan Kariganur to present his innovation in rural surgery.
Yeah.
Please start.
Yeah. Can you hear me?
Yeah, Dr. Madhusudhan is a general surgeon from Shirgupa. He completed his term as EC member yesterday. An immediate past state president IMA Karnataka, past editor IMA Focus 3 years, past secretary IMA KSS and treasurer IMA KSHS, chairman IMA Karnataka Building Committee, and has got best publication national award, Medical Achievers National Award for Social Activities, Best IMA State President by IMA Headquarters. He's a multi-talented personality. I welcome Dr. Madhusudhan.
Yeah. Thank you, Dr. Divakar, for that kind introduction. Can you hear me?
Yes, Madhu. Yes, Madhu.
Yeah. Thank you for this opportunity. I thank KSCASI for this beautiful opportunity. As the previous speakers told regarding the challenges and the knowledge of the rural surgeons that we have. As rural surgeons, what we can do in our small place is totally depends on our personal ability and facilities that is available to us. However, we have our specific limitations due to the technical, professional and legal problems. I'm not able to see my screen. Somebody have taken it out.
So do you want us to share it?
Yeah, I will share myself. I'm sharing myself. Yeah. Can you see the screen?
Yes, sir, it's visible.
Yeah. This is the second slide. Can you see that?
Yes, sir.
Yeah. Definitely, we are limited due to the technical, professional and legal problems also. Rural surgical practice is a nascent field to innovate our own things, unlike the urban, where one can have everything at the drop of a hat. Lack of sophisticated equipments or non-availability of qualified staff doesn't deter us. In fact, these are the challenges which have prompted us to innovate our own ideas, as told by Dr. Shivanand. We have our own requirements and our needs. The things that I am presenting may surprise you in a way you would have done it already, that in your hospital, and it may look very silly also. However, these things will go a long way in avoiding the monopoly by the equipment makers who take us for a ride in the name of the AMC, CMC and whatnot, and also prompt you to use the things in and around you to use when in need. As said by Albert Ascent, who is the inventor of the vitamin C, the innovation is saying what everybody has seen and thinking what nobody has thought. That is what I am going to present. What are the advantages of innovation? Definitely, it improves our productivity, reduces the costs, increases our competitiveness and satisfaction in the profession. And as I told, maybe I'll start from a very basic inventions like needle cutter. The biomedical waste guidelines definitely mandates us to dispose the used syringes and needles, and they need to be cut. The syringe need to be cut at the neck, the hub and the needle to be cut at its neck. Definitely, it has to be disposed. And what are the types of the needle destroyers that are available to us in the market is electrically operated, and it has got its own disadvantages, like it is a costly, it is 2,500 to 3,500 rupees. Electrical supply is a must and cannot be, that machine when broken or under repair, it cannot be reusable. The whole apparatus has to be disposed. And the other one is the mechanically operated one, and it is costly. The blades lose the sharpness very easily. It will cut only up to 250 syringes. When it loses its sharpness, the blades cannot be replaceable, the container cannot be reusable, the whole apparatus has to be disposed. And what we have innovated, we have innovated a cost-effective syringe destroyer. It is very cheap. It costs around 100 to 150 rupees. The recurrent expenditure is only 50 rupees. The blades long lasting. Take it from me, I'm using for the last 10 years. It is usable up to 4,000 syringes. I'm just putting the lower end. It will be usable up to 5,000 to 6,000 syringes. The blades can be easily replaceable. The whole apparatus can be reusable. What is it? It is simple. The electrical nibbler that electrician uses in our daily routine place. How it can be fixed? I have shown you a picture on the lid of a container. You just make two holes on that. One bigger hole to fit into the for fitting the syringe and the needle, other to fix the cutter. This is the way. This is the way it should be fixed, and it will cost you hardly 150 rupees. And how to dispose these syringes? As you all know, the plastic has to be disposed in a specified container, that is a bag, and the sharp needle is to be disposed in a PPC, puncture-proof container. And I have shown a box on the right side. That is, everybody, we dispose of and throw off these bottles which are used for the jelly that we use for ECG or ultrasonography. That is the puncture-proof container. We can dispose these needles into that and then hand it over to biomedical waste people. And as one of the speaker has spoke about the crush injuries of the hands, definitely rural surgeons, we come across lots of crush injuries which with the phalangeal skeletal fracture, which are common in rural practice. Early mobilization remains the most effective way to counter the edema, joint stiffness, and tendon periosteum adhesions. And K wires, as it is called as Kirchner's wires, of 1 to 1.2 mm are introduced to achieve this. See, you can see the pictures that practically what I do in my rural practice. I use the availability of the K wires in a rural practice to maintain them, sterilize them is a big challenge and headache. And I use 18 or 20 disposable needles to fix the terminal phalanx, especially the terminal phalanx fracture. You can see that on both the sides, different sides have been used, and you can check it up from a check X-ray whether it is in place or not, and the results are excellent. You can see the results. They have taken up very well, even 0.5 to 2 mm adhesions to the skin, definitely it will maintain the vascularity. And my special interest is, as Shivanand told, we are concentrating more on the equipments, the inside table, everything. We have forgotten the wall cladding in the operation theatre. What have not used in the previous days? We used the aluminum partitions with wooden partitions, from ceramics to vitrified tiles, and the fashion is the galvanized steel. Each and everything, each one of it has got its own disadvantages, and mainly for the rural surgeons, cost is the factor. Steel, galvanized steel, it has got its own advantages, disadvantages. As we have seen, these tiles, a costly affair. It will cost around 100 rupees, and they fall off easily due to heat because of the tropical region of our places, and they are difficult to replace, and needs glue or epoxy to fix, and needs curing, and you need to close the OT for 5 to 10 days minimum. And on the right side, I have shown the white rust of the galvanized steel, and galvanized steel definitely for a rural place to erect and to install is also very difficult. Costly 400 to 1,500 per square feet, and they are not resistant to white rust. And what I have found is the vinyl cladding. I have found out this is one of the best thing that we can have. Hospitals and vinyls are made match made in heaven. And what are the pros of using PVC panels? The installation can be done in one day, less damage to the walls, they are easily replaceable, resist moisture and corrosion, and very damn cheap. It is 50 rupees to 70 rupees per square feet, including installation charges and whatnot. The ignition temperature is 370 degrees centigrade, so they do not burn easily. In case of fire, they emit lesser smoke compared to wood, and the byproducts formed at combustion are non-toxic to the nature. And the PVC panels are finished surfaces, then they don't need any extra finishing like painting or polishing. So they are lightweight panels, so that's why the installation process is short. These panels can be easily cut and installed without grouts. Many panels have interlocking tongue so that which make them easy for fixing. It also helps to replace a single panel when there is a panel breakage or a problem with if there is a damage to single, it can be replaced within half an hour. They are made from color impregnated PVC, therefore color will not alter with the time. They are washable. See, you can see this is practically what I have followed in my operation theater for the last 5 years. 4.5 to 5 years I'm using. You can see on the right side, that was the ceramic tiles that I was using for 10 to 15 years. Definitely you can see there is a change here. When a portion of the wall was, the ceramic tiles were broken, I need to close my OT for 10 to 15 days for curing and also for the maintenance. On the right side, a same partition through the PVC wall cladding. So this is my OT. You can see the PVC wall cladding, aesthetically beautiful. You feel very calm and composed when you enter the OT and see these tiles. See, even my washroom area, hand wash area, this is the hand wash area. Even my room false ceiling, which we prefer the plaster Paris, we can replace them with polyvinyl chloride sheets. Even on my right side, right lower side, my consultation room is fixed with wall is fixed with polyvinyl chloride. And definitely it allows the architects to free reign because there are almost infinite options to design with the vinyl. Available in many colors and designs and shapes, the material flexible, and definitely each one will have its own pros and cons. What are the cons? They are all thin sheets. One needs to take caution so that it doesn't get hit by sharp objects and that can cause scratches. Nailing and screwing will become a problem tricky. You need to plan accordingly. Yeah, these are the sheets that are available in the market. You can choose whatever the colors you want. You have plenty of options to choose. This is about wall cladding. I'll be jumping from one subject to other very haphazardly. So, bipolar forceps cables that we use regularly in our surgery. See, these are the regularly available bipolar cables. They lose their strength, they becomes very friable, they lose their electrical connections in between. So they will be, because of the workers, they don't clean it properly, they use lot of pressures to clean the wires. So there we lose the solderings of the connections. And if you want to go for the new one, it will cost around 1,500 to 2,500 rupees. And what I have designed is, you can just take it from me 0.25 mm 2-port wind cable, which costs only 30 to 50 rupees, including soldering. Nothing but a twin wire that we use in the electrical connections. This is available in any of the electrical shops. Just give it to an electronic shop. You will get the terminals, used bipolar terminals soldered, and that can be used for 2 to 3 years without any damage. So that is one. And draw sheets. All our rural practice is filled our outpatients, and many of our work rotates around dressings of the contaminated wounds, and lots of injuries will come. In the minor OT, we need to replace our sheets on the minor OT table on and off. For every patient, we need to use a separate draw sheets, and the available in the market, the available draw sheets, the disposable draw sheets, which are really costly, 30 to 40 rupees, which our patients are not affordable. And what is the alternate? What we have chosen? See, these are the, I have taken this butter paper, or what we, holige paper, we call it as. It will come in all the different sizes. The paper that are used during the marriage period on the dining table, they are made of butter paper, parchment paper. One side it will be glossy, the other side it will be paper, and they are definitely eco-friendly and cost. You can make any size out of them, and it definitely cheaper and cost is less than 1 rupee, and you can autoclave those things into different sizes and you can use it. I'm using for the last so many years. So these are the things, these are the common dressings that we encounter. Definitely we can dispose them off with the dressings along with we can make these sheets as bowl towels also. Yeah. And as rural surgeons, many of our patients comes with all sorts of problems. They, as a general surgeon, they think that we can deal with any of the surgeries or any of the organs. So many of the people come to us after taking the token and sitting for 2 to 3 hours. When they come inside with an ear problem with the impacted wax, it's very hard to convince them to refer to an ENT surgeon. We are very scarce in our smaller rural places. So we need to have for ear syringing the designated ear syringe. Definitely it's very hard to maintain them. Very rarely we will get such patients. To maintain that is a difficult, you will forget where you have kept it. So the very simple alternative is take a 10cc syringe, take 5 to 6 inches of used drip set piece, attach that one to a 10cc syringe, use lukewarm water to clean the dewaxing, removing waxing of the ear. Definitely it's a very easy procedure, very friendly, patient friendly, and definitely we need to remember the contraindications to ear syringing like acute infections and discharge, everything. And coming to the end, the rubber pipings. Almost all of our operation theatre and hospital will be in and around. We use lots of our equipments are used with PVC or rubber pipings. Take it from the OT. The suction apparatus, the inter bottle connectors, these are, as I'm showing, this red marker is there. This is made of plastic. The connecting pipe to our suction pipe is also made of plastic, and the hose pipe which connects the monitor to the BP cuff is made of rubber. Over a period of time, they becomes brittle, they break, they give away in the suction apparatus, it starts leaking, even in the hose pipe also starts leaking. Very difficult to get these spares from the market. And if you get it, these hose pipe, it will cost you around 1,000 to 1,500 rupees. And these plastic pipes, very difficult to get the size and replace. So what I have found out is, these are the silicon rubber tubings that we get in the market. Take it from me, on the right side, there is a 4 mm inner diameter. This is 5 meters, which is practically it is there with me. This is 5 meters, which will cost around only 150 rupees. This is 4 mm diameter. You can use it for the monitor as a hose pipe. You can use it for a BP apparatus cuff also, regular BP apparatus, a connecting tubing also. You can use it. And on the left side, you have the silicon tubings of different size. These can be cut into half feet, 1 feet, and can be used to connect these things. And take it from me, they are all permanent. They are all permanent. Once you invest, that is end of it, 5 to 6 years, you need not have to be used.
Madhu?
Yeah.
Yeah, can you conclude, please?
Yeah. It's been an honor to be among such accomplished individuals and be able to present my perspective before you all. Thank you very much. Thank you, Divakar, thank you, Dr. Sapimat.
Thank you.
Thank you very much.
Thank you, Dr. Madhusudhan, for your informative speech for a rural surgeon for a cost-effective management. Okay, thank you. Thank you, Dr. Madhusudhan. I invite Dr. Rohini Kulkarni.